Good afternoon, Dr. Bowie with Simply Health DP3 here in Federal Way. Haven't made any video in the last couple of weeks. But I've been on this thought process, and it's just been amazing. So what I wanted to share with people is so I have to admit, I had a couple of patients that was sent to me by colleagues around nearby for difficult back pain patients, and specifically they were noticing this lack of a better word, pain in their butt, right? And so butt pain. And we joke about it, since we were struggling to treat them, we were calling them a pain in the butt. But anyways, I was using my traditional points that I was using, for perineuro. It's like a combination of trigger point and peripheral nerve blocks that I was using on these patients. And for the most part, most of my patients were doing really well. But I struggled. I had like 3 or 4 patients that were sent to me that specifically pain in their butt where they're sitting, and I was targeting the different muscles, the cluneal nerve, and things, and their IT band, and they felt okay, but I could never really knock out that pain in their backside. And it bothered me, and I always asked the patient, "Hey, be patient with me. It'll take 2 or 3 sessions before it fully kick in." And unfortunately, they would make progress, but they wouldn't make the progress I needed to. So typically, the work that I do, you get a period of relief. It'd be hours to days on the first session, and then it gets bigger and bigger and bigger, and then boom, within 6 to 8 sessions, the different things I do with the patient, with the injection, the adjustment, they're done, right? But again, with these, I had 3 or 4 patients that it wasn't. It just, that window of improvement was stayed the same, and it frustrated me, and I felt bad because obviously my patients who were very hopeful started losing hope, and yeah, they just chose not to come, which I totally understand. Anyways, I was working on a patient about a month ago, maybe, severe osteoarthritis of the knee, and he walked, really bow-legged. And in working on him, he noticed there was some pain in there that he was like, no, it's very pinpoint to the inside of his knee. And, it made me think about it. And so on his second session, we're working on it. And he's like, no, it feels all right, but I still have all this discomfort right here. And I was like, it made me think. I'd been thinking about all week before that. And anyways, I was like, what are the odds that his hamstrings, where it's attached to the medial knee, right? And so you I apologize, here. And so, you look at your hamstrings where it's attached to this bone here. It's the ischial tuberosity. And so you have the bicep femoris, one muscle attached to the outside knee, and then the other semitendinosus attached here running down to the medial knee. And again, I was like, what are the odds that these things are, and in the past I would target the different muscles, and the results wasn't there. And anyways, I decided like, well, what happened if I go further down? Anyways, I injected him, and when he got up, he's like, wait, the pain is better. But what was more impressive was that when I watched him walk, I noticed that his knees were not as bowed, and I was like, that's interesting. Well, anyways, I had a couple of sleepless nights, about three sleepless nights, and I woke up at 1:30 in the morning. I can't remember what day it was, and I was like, oh my God, I wonder if all that pulling from your hamstrings, right, is pulling on your backside, and that's why they have this butt pain and then tension in the lower back. And yeah, then I went on this road where that's all I want to do. And, I don't talk too much about it, but I'm still active duty in the military down at Fort Lewis. And luckily for me, my office is near our physical therapist. So I have a number of patients available to me. And so I walked in that Monday morning, and I just went at it. And I was like, hey, are you here for back pain? Do you mind if I work on you? And I just, limited to the points focusing on the hamstrings and their adductors. I didn't want to do the lateral hamstrings yet because, again, if you look through literature, you'll see that the medial knee is typically the problematic for osteoarthritis. So then it kind of led to me, I was like, huh, I wonder how much is the medial hamstring is a culprit for a lot of these things. So let's start there first and not overdo it, because then I won't know what is working, and I hate to inject people in unnecessary places. Anyways, I targeted the medial knee and then the adductors, and amazing was these guys responded. And they're like, "Sir, my stiffness in my back, my lower back, my knee pain is better." And I was like, "Wow." But what really blew my mind was I was working on a retired Green Beret, really decorated, and he never talked about it. It wasn't until one of his friends told me about his background, and I was like, "Wow, that's super impressive." Anyways, uh, this gentleman, multiple back surgery. I had three previous sessions with him, worked on him, and he'd get up and he's like, "Yeah, took the sharp pain away. I feel pretty good. However, I still feel really tight." Um, and so it wasn't amazing, right? And he was getting relief progressively. And again, I had three sessions. Anyways, he had left the area for his work. He came back and he messaged me and told me, "Hey, that trip." He was out for a while, a couple months. I didn't see him for about 2 months. Anyways, he's like, "Yeah, I have a lot of stiffness and there's all this pain." So I was wondering if I could follow up. And I was like, "Okay." And so again, I asked him, I was like, "Do you mind if I just use just this protocol to see how you do?" And so he was amenable to it. Did that protocol. He got up and he's like, "Wow, this is the best I felt. I actually feel like I can stand up straight right now, and I've never had this for a long time." And again, it makes you think about, like, how involved or uh, how much of the hamstring is causing all this tension in your backside and your lower back, and then your muscles of the front, your core muscles. And that's what, a lot of patients with back pain, they're always told, like, "Hey, your core muscle is weak and you got to work on it." Well, is it the core muscle is weak, or is it you have overstimulated hamstrings that's causing all this tension that, again, your body then will react and causes a forward flexion to counter this tension in the backside. And that's why a lot of them tell me that, "Hey, I feel really stiff, and despite stretching, they just don't get anywhere," right? Anyways, um, he responded really well, and it just lit me up to another moment of joy. And for over a week now, over about 2 weeks now, I was just identifying soldiers with back pain and doing this protocol, and exceptional responses. I then went back to my list of patients that I struggled with, had him called, contacted them, pleaded with them, like, "Please just come back in and let me work on you. I feel terrible that our previous sessions didn't lead to what I would hope for." I mean, I offered free treatment to them. Actually, I said, "Hey, I feel terrible. You had paid me a couple of sessions. I couldn't deliver. So please come back. I won't charge you for this session. Don't worry about it." And so several of them took my offer, like almost all of them, except for one. I haven't been able to get a hold of them. Anyways, the results have been amazing, right? And so uh, I've just been super happy. And I just finished up a session with a patient. Um, and, you know, it's crazy is that, she has lower back, but also upper back, neck, shoulder area. And it's all on her right side. And, so I was treating her. She got up and moved around, and she just like, "Oh my God, that pull in my groin is gone." And then I targeted the lateral, and boom, she's like, all that pain is essentially almost gone. It's just a little stiff, and she just felt this release. Her energy was there. She's like, "I feel alive again." And she's young, she's younger than me. Anyways, it brought a tear to her eye, and very emotional, because again, this type of work for me is very intriguing. It's very personal, right? You take someone who their life has been altered because of this pain, and you're able to treat them, free them up from this pain that allows them to live their life, right? But yeah, it was a great session today with her. And so she asked me if I could work on her upper back and neck and shoulder, and I said, I can if you want, but I would love to see how much of your lower back was causing this, and would you be willing to like test this out? And again, she's very amenable to it. Uh, and so, and actually, while she was walking, she felt the tension in that area start to loosen up. Uh, so it'd be great to see her feedback for me here later this week. Because I'll text my patients just to learn what's going on because it helps shape my thought process of how to help people, right? And so yeah, it's going to be interesting to see what she says, and if it plays out the way, oh my God, that'd be amazing, right? Treating the lower back and hip to then release her upper shoulder neck area that she's been struggling with for years, and I mean to the point where you know I didn't have a good answer, and we ended up getting an MRI, and crazy enough is her MRI of her lower back is fine. But the MRI of her neck showed some changes, some nerve impingement that I got concerned. I was like, hey, let's get you to a neurosurgeon because, a couple months ago she had started mentioning something about her right hand or arm or shoulder or something like that. And so I was like, wait, do you have symptoms there? And uh, so I was, when I saw the result, but anyway, she was like, actually, no, I don't have any really symptoms in my arm. It's always been my lower back, and which confused me because again, the MRI findings on the lower back was really no nerve impingement, but the upper showed like one of the nerve was affected, but yet she had no symptoms, right? So interesting is that did it cause something that I'm sorry, I'm rambling at this point. Anyways, Dr. Bowie here at Simply Health DP3 in Federal Way. Yeah, if you're struggling with knee, back, neck issues, and unfortunately, if you're not recovering, please check us out here in Federal Way. I'd love to help you any way I can. Have a good day. Dr. Bowie out.